cervical intraepithelial neoplasia, that is CIN. It is also known as squamous intraepithelial lesion. So, cervical intraepithelial neoplasia is also known as squamous intraepithelial lesion. It is a precancerous lesion which is linked with a virus, HPV virus, that is human papilloma virus. Cervical intraepithelial neoplasia, it is a precancerous lesion which is linked with human papilloma virus infection. HPV, it is transmitted sexually. The route of transmission is through sexual contact, and it is a DNA virus. HPV is a DNA virus. The route of transmission is through sexual route. It can lead to cervical intraepithelial lesion, and this can eventually progress to invasive carcinoma. HPV के इन्फेक्शन के कारण पहले cervical intraepithelial neoplasia होगा, and this can even change into invasive carcinoma. See, there are three types of cervical intraepithelial lesion, that is cervical intraepithelial lesion 1, 2 and 3. But according to the Bethesda system, there are two categories. These precancerous cervical lesions are categorized into two categories. Bethesda system में दो ग्रेड है, that is low grade and high grade. Low grade squamous intraepithelial lesion, that is LSIL. LSIL में CIN1 आता है. लो ग्रेड स्क्वामस इंट्राएपिथेलियल लीशन में सर्वाइकल इंट्राएपिथेलियल नियोप्लासिया 1 आता है, एंड लो ग्रेड इज एसोसिएटेड विथ HPV 6, 11, 42 and 44. These have low oncogenic potential. The low grade are associated with HPV 6, 11, 42 and 44. CIN1 or LSIL is associated with HPV types 6, 11, 42 and 44. These have low oncogenic potential. And the high grade squamous intraepithelial lesion, इसमें CIN2 और 3 आते हैं. CIN2 और 3, these are high grade squamous intraepithelial lesion or HSIL, and these are associated with high grade high risk HPV, that is types 16, 18, 31, 33 and 45. HPV type 16 is the most common cause. सो बेथेस्दा सिस्टम के अकॉर्डिंग ये जो प्री कैंसरस लीशन है उसका दो ग्रेड होता है, लो ग्रेड स्क्वामस इंट्राएपिथेलियल लीशन और हाई ग्रेड स्क्वामस इंट्राएपिथेलियल लीशन. लो ग्रेड में CIN1 आता है एंड इट इज़ एसोसिएटेड विथ HPV 6, 11, 42 एंड 44. और हाई ग्रेड में CIN2 और CIN3 आता है एंड दिस इज़ एसोसिएटेड विथ हाई रिस्क HPV, दैट इज़ HPV 16, 18, 30, 31, 33 and 45. HPV 16 is the most common cause of HSIL. Low risk are HPV 6, 11, 42, 44. High risk is HPV 16, 18, 31, 33 and 45. Then there are three types of cervical intraepithelial lesion. Cervical intraepithelial neoplasia, that is 1, 2 and 3. 1 में माइल्ड डिस्प्लेशिया होता है, 2 में मॉडरेट डिस्प्लेशिया होता है और 3 में सीवियर डिस्प्लेशिया होता है, और इट इज़ ऑल्सो नोन एज कार्सिनोमा इन सीटू. CIN1, that is mild dysplasia. In this, the dysplasia is limited to the lower 1/3 of the stratified squamous epithelium. CIN1 में सिर्फ lower 1/3 तक लिमिटेड रहता है. It may appear as a raised or flat. Raised similar to condyloma acuminatum and flat like a macula, and it will have abundant low risk HPV nucleic acid. The features are coilocytic atypia, viral cytopathic effects characterized by nuclear abnormalities and perinuclear hollow. CIN1 में जो dysplasia है, that is limited to lower 1/3 of the stratified squamous epithelium. It can appear as raised like condyloma acuminatum or flat like macula. In this, abundant low risk HPV nucleic acid is present. Abundant low risk HPV nucleic acid is present, and the features are coilocytic atypia or viral cytopathic effects. It is characterized by nuclear abnormalities which include nuclear enlargement, hyperchromasia, along with perinuclear halo. तो CIN1 में कोइलोसाइटिक एटीपिया मिलता है, फिर न्यूक्लियर एबनॉर्मैलिटीज़ होता है विथ अ पेरीन्यूक्लियर हैलो. Then CIN2, in this the dysplasia will be limited to the basal 2/3 of the stratified squamous. ठीक है, CIN2 में moderate dysplasia होता है. Dysplasia is limited to the lower 2/3. In this, atypical cells will be increased as compared to the CIN1. CIN2 में there is progressive atypical cells and they will have features like increased NC ratio, nucleus to cytoplasm ratio, anisokaryosis, loss of polarity, presence of mitotic figures and hyperchromasia. Okay. CIN2 में increased number of atypical cells are there in the lower layers along with features like increased NC ratio, loss of polarity, presence of mitotic figure and hyperchromasia and anisokaryosis. Yeah. But the upper layer will have signs of differentiation. Lower layers में there will be increased number of atypical cells, but the above layer they will show signs of differentiation. And high risk HPV types are associated with CIN2. CIN2, it is a high grade squamous intraepithelial lesion. So the high risk HPV are associated to CIN2. Then CIN3 में severe dysplasia होता है. It is also known as carcinoma in situ. इसमें the dysplasia is involving the entire thickness of the epithelium. CIN1 में lower 1/3, CIN2 में lower 2/3 और CIN3 में entire thickness. ठीक है, इसमें severe dysplasia होता है and CIN3 is known as carcinoma in situ. Yes, CIN3 में there is diffuse atypia, there will be loss of maturation और जो immature basal cells है they will reach the surface. There will be expansion of immature basal cells to the surface. Then जो low grade lesions होते हैं 60% will spontaneously regress. So most of the low grade lesions they regress spontaneously. लो ग्रेड लीशंस जो होते हैं वो 60% रीग्रेस कर जाते हैं, 30% पोसिस्ट करते हैं और 10% जो है दे कैन बी कन्वर्टेड टू एच सेल. ठीक है, बट मेजॉरिटी जो होता है वो रीग्रेस कर जाता है. वहीं जो एच सेल होते हैं मेजॉरिटी ऑफ द एच सेल दैट इज़ हाई ग्रेड लीशन दे टेंड टू एडवांस. ठीक है, एच सेल जो है दैट within 2 to 10 years it can be converted to carcinoma. They have a higher risk of getting advanced. HCL में 2-year follow-up में 30% regress करता है, 60% persist करता है and 10% have the chance to convert into carcinoma within 2 to 10 years.